HbA1c testing, how it works and why it matters. HbA1c, or glycated hemoglobin, is a protein in red blood cells that binds to glucose molecules in the blood. As red blood cells have a lifespan of approximately 120 days, the amount of HbA1c in the blood reflects the average blood sugar levels over the past 2 to 3 months. HbA1c testing is therefore an important tool for monitoring blood sugar levels over time, which is essential in managing diabetes effectively. By measuring HbA1c levels, healthcare providers can determine whether a person's blood sugar levels have been consistently high, indicating poor diabetes control, or have been well controlled, which can help to prevent complications associated with diabetes. HbA1c testing is widely used as a standard diagnostic tool for diabetes and is recommended by various diabetes associations and healthcare organizations worldwide. HbA1c levels have been extensively studied and shown to be strongly correlated with the risk of developing complications associated with diabetes. Research has demonstrated that higher HbA1c levels are associated with an increased risk of kidney disease, nerve damage, and eye damage, among other complications. This is because high blood sugar levels can damage the blood vessels and nerves that supply these organs and tissues, leading to impaired function and potential long-term damage. By monitoring HbA1c levels and striving to keep them within a healthy range, people with diabetes can reduce their risk of developing these complications and improve their overall health outcomes. HbA1c testing works by measuring the amount of glycated hemoglobin in the blood. Hemoglobin is a protein found in red blood cells that carries oxygen throughout the body. When glucose molecules in the blood bind to hemoglobin, a process known as glycation, glycated hemoglobin is formed. The amount of glycated hemoglobin in the blood reflects the average blood sugar levels over the past 2 to 3 months, as red blood cells have a lifespan of approximately 120 days. HbA1c testing is a simple blood test that is widely used to monitor blood sugar control over time in people with diabetes, providing important information for diabetes management and prevention of long-term complications. Normal HbA1c levels are generally considered to be below 5.7%. This means that, on average, less than 5.7% of the hemoglobin in a person's blood is glycated. A result between 5.7% and 6.4% is considered to indicate prediabetes, which means that a person's blood sugar levels are higher than normal but not high enough to be classified as diabetes. A result of 6.5% or higher is indicative of diabetes, which means that a person's blood sugar levels are consistently elevated and require medical management. It is important to note that HbA1c levels can vary depending on factors such as age, ethnicity, and certain medical conditions. Additionally, higher HbA1c levels indicate poorer blood sugar control and an increased risk of complications associated with diabetes. By monitoring HbA1c levels regularly and working with healthcare providers to maintain healthy levels, people with diabetes can reduce their risk of developing long-term complications and improve their overall health outcomes. In conclusion, HbA1c testing is a critical tool for effective diabetes management. With strong scientific validation and a simple testing process, HbA1c provides valuable insights into a person's blood sugar control over time, allowing for early intervention and prevention of long-term complications. By understanding the underlying principles of HbA1c testing and interpreting results correctly, people with diabetes can work with their healthcare providers to optimize their blood sugar control and improve their overall health outcomes. So, if you have diabetes or are at risk for developing diabetes, make sure to talk to your healthcare provider about HbA1c testing and how it can help you stay on top of your health. Thanks for watching.